Hey guys, it's Dr. Justin Marchegiani here. Really excited. We are doing a YouTube and a Facebook Live. Look forward to answering some questions. I was at Paleo FX all last weekend. Great events. Lots of great information, lots of great speakers. I was one of the speakers at a talk on thyroid, did a panel as well. Really good information, lots of good knowledge bombs dropped all weekend. But let's dig in today. What's on your mind? What do you want to chat about? Facebook, YouTube, let me know what's cooking. All right, so off the bat, Rajat writes in T3 levels at 49, T4, 2, TSH, more. Those numbers don't make sense, Rajat. Try to type it out again for me. T3 colon, whatever the number is. I'm seeing 49. Is that T3 total? T4 is at 2? Just write those out for me. I'm not sure which one you're talking about there for me. Make it a little more clear. So what do you want to chat about today, guys? As you come up with your questions, what's on your mind? So I got a Thyroid Reset Summit coming out really soon. We got some of the best and brightest minds in the thyroid natural health world. Make sure you subscribe, www.thyroidresetsummit.com. Subscribe, get access to it. I'm interviewed, Evan's interviewed, lots of other great, brilliant minds. And again, the goal of this summit is to really give you actionable information on the diet side, on the lifestyle side, on the supplement side, on the lab analysis side, really to give you good clinical information that's going to help improve your health and help you get better. So start there, thyroidresetsummit.com. Get subscribed now. It'll be this fall, but we'll get some emails out to you soon too. Lots of good free info. Is kratom harmful to kidneys or the liver? Great question, Tia. So kratom is one of these herbs. It's like, I think it's from Mongolia maybe, but it's one of these herbs that had been used more recently to help people get off like opioids, whether it's fentanyl or oxycodone or any of these dangerous opiates. So it's one of these herbs that are being used. And I have some patients using it and they've gotten pretty good results with it. So I think it's something that you need to work with your conventional doctor who's tapering you off, whether it's Suboxone or Oxy or fentanyl, whatever. You have to make sure that you're working with a provider that's kind of helping you taper off that. So you're doing it in a way that's responsible. Ideally, don't get on it to begin with. Anyone's listening and has chronic pain, try not to get on it to begin with. Try to use all the natural holistic means to avoid it to begin with, because it can be very addicting and very hard to get off. But I found it to be good. I mean, if you're concerned about that, make sure you're working with the provider to monitor kidney and or liver function through a comprehensive metabolic profile to make sure you're doing good. Kitty writes in, reoccurring infections, even though you already treat them according to the GI map. So yes, some people come up with a second round of infections. It could be the same infection not addressed. It could be a new infection that was burrowed deeper into the gut lining and coming out. So fix what you find. Evaluate how much you've improved. I've had patients that come back with new infections, but their symptoms are like 70 to 80% better, which is great. So if your symptoms are improving, awesome. And new infections come up, I would look at getting those treated. If you're not quite all the way there, but there's some new infections still lingering that come up that are on the newer side, then we definitely want to treat them. I think they could be things that are holding you back for sure. All right, let me keep on rolling here. Charletto writes in, can you talk about viruses? Some functional med people have a virus phase part of their protocol. So the big common viruses are going to be like Epstein-Barr viruses. Those are going to be the big ones. Epstein-Barr, cytomegalovirus. Those are the big ones outside of maybe just the common flu. Now, some of the things that we'll use in our protocols for that is ginger is really excellent for virus activation, or kind of taking the virus from adhering onto the cell wall. Ginger's great. In my line, we use GI Clear 3, which is a nano silver solution, which really is antiviral. High dose berberines, like in my GI Clear 4, we have a lot of golden seal. That's very much antiviral as well. And then if there's other antiviral things, I have one product called monolaurin synergy, and that's very high monolaurin. Monolaurin is like an extract from coconut, and it basically breaks down the cell wall, the cell envelope of the virus, which exposes it to the immune system so the immune system can now attack it. Hope that helps. Those are some of the things that we will use to add in there to kind of knock it out. But some of the herbs that we use in the clearing phases of natural gut infections will kind of carry over, like the ginger will carry over, maybe the silver will carry over, the berberines will carry over. So some things that are already built in naturally to help. Kitty Johnson, what did your last GI map say? Do you mean my personal GI map? I got to run a new one. The last one I ran was just last year. I just had a little bit of bacterial stuff, nothing major, no major infections. I've been infection free for a bit, but I do need to run it and see where I'm at. I typically do that yearly, even though I'm symptom free. I do that yearly just to make sure I'm on track. A couple questions here on the Facebook side. Menopause or nausea? What's the main difference between functional medicine and conventional medicine? Well, Ryan, I would say off the bat, it's going to be getting to the root cause. Conventional medicine will typically use medications that treat the symptoms, and they typically block or inhibit various pathways. They do nothing to upregulate physiology. They do nothing to get to the root cause. So functional medicine works upstream at the underlying stressors, physical, chemical, emotional. They work downstream to the body's systems that may be out of balance, hormones, gut, detox, nutrients. The symptoms are very much downstream. This is where everything kind of manifests. We are upstream at the systems and the stressors. Conventional medicine typically is down here at the very bottom, or I should say down here, over here at the very bottom, dealing with the symptoms. And it's symptom drug, symptom drug, symptom drug. Hormonal imbalances, birth control pill. Menopause, maybe Prema and Provera. Depression, SSRI. Anxiety, benzodiazepine. Sleep issue, Lunesta. Right? So you can just go back and forth with the drug, symptom drugs. It's not that difficult. And again, a lot of these drugs are dangerous. So we always rather use something more natural and get upstream to the underlying cause that caused the issue to begin with. Does that make sense? Hope it does. Jeff writes in, my wife and daughter left me Saturday. My stomach has been in knots and burning and nerves are terrible. What can I do? Well, I'm really sorry to hear, Jeff, that what's going on personally. That's a bummer. I would just make sure that you are, number one, I know your health is kind of up in the air. So I would work on yourself because you can't help anyone else until you get your health back. So I'd work on getting your health and doing all the foundational things. I'm not sure where you're at with the foundational health things, but I'd make sure you're eating the best of quality food you can get. You're drinking the best of quality water you can get. You're doing your best to get good quality sleep. And you figure out what you can handle on the supplement side just to make sure you're able to digest and break down your food, and just start there and then get everything under control with your health before you try putting all the stuff back with your family, because I know that all the stress you're under, your health may not be able to deal with that. So I wish you the best. Ellie writes in, can you have ulcerative colitis and not bleed? I get a burning feeling every morning before I have a bowel movement, and I eat fairly healthy, no spicy foods. Well, typically the definition of ulcerative colitis is there has to be some kind of ulceration. So typically there would have to be some kind of bleeding that would be present for a diagnosis. Of course, ulcerative colitis has to start somewhere. That mechanism has to start moving, and typically there's bleeding at the very end stage. So of course that is possible. There could be another type of IBD brewing, like a Crohn's or even a microscopic colitis, or even just an IBS. There could be other natural inflammation that's happening that you don't even see or know. Just that gut lining starting to thin. Atrophic gastritis could start with the stomach. Just gut inflammation, lower IgA levels, gut infections could easily be starting to brew and causing some of these symptoms, and may not necessarily be ulcerative colitis. And it's going to be hard to be diagnosed on the conventional medicine side if you don't have typical conventional medicine symptoms. Does that make sense? Make sure my camera's going here, guys. There we go. Awesome. So again, it's tough when you're trying to get diagnoses ahead of time. It's really hard when these diagnoses tend to be more end stage. You need a lot of symptoms present before that can be picked up. Let me keep on rolling on the list here. Vivek writes in, what's the reason behind the dawn phenomenon seen in diabetics? How do you treat it? Typically, the dawn phenomenon has to do with a cortisol increase in the morning, and the Somogy effect has to do with a hypoglycemic response that happens during nighttime that drives an adrenaline cortisol boost in the morning. So dawn phenomenon tends to be more of a cortisol issue. We look at people's patients' adrenal cortisol rhythms, and we work on fixing the rhythm and get to the root cause of why that is, whether it's a diet issue, a blood sugar issue, extreme adrenal stress. We add in specific supplement supports for sure, but we want to make sure we get to the root underlying physical, chemical, and emotional stressors that could be at play. Infections are big ones because infections are really active at night, and the inflammation that occurs at night, the body responds by making cortisol, and that cortisol can spill over into the morning time and increase blood sugar in the morning too. What's the easiest and best treatment for toe fungus for someone that has Parkinson's and dementia? Thank you, Kim. I would go to my site and look at the toenail fungus soak. That's a good product that uses specific herbs that are mixed with apple cider vinegar. You soak your feet 5 minutes at night. That has an excellent cure rate. Charlie writes in, that's Jay. Is anxiety and fatigue common with H. pylori die-off? It can be because of the lipopolysaccharides that come off the H. pylori. So ginger tea is going to be helpful, maybe even some activated charcoal and some binders like good true fiber in between meals. 3 hours after, 1 hour before can be helpful just to bind up stuff. But start slow, work your way up. If you're having a whole bunch of issues, follow the die-off reaction handout and calibrate that dose. Don't continue to push it. Massimo writes in, since I have adrenal fatigue, I tried some adaptogen herbs like Schisandra and licorice root with some benefits and energy levels, but I'm wondering why my insomnia gets worse. Well, licorice is one of those herbs that can boost up your cortisol. So if your cortisol is maybe lower during the day and higher at night, you could be boosting up your cortisol at the wrong time of the day, and that could be really increasing your energy at night and messing up your natural circadian rhythm. So you want to get that looked at more specifically and maybe not go with the shotgun approach. Is it normal for my stomach to feel tight on a regular basis? Well, if you're using too much of the clearing herbs and not calibrating the dose, yes. Senyata writes in, my 5-year-old daughter is suffering from canker sores in her mouth. Is there a vitamin or mineral that she may be lacking? Thanks. Well, zinc's a really important one, but in general, she's probably eating gluten. She's probably very gluten sensitive. Get that fixed. Get off the gluten, go grain free, and then work on the other stuff we talk about with the gut. Get a gut test done. Go to justinhealth.com/shop, click on the lab test, order that GI map. That'd be great. When choosing fungus killers, is it better to pick artemisinin or artemisia based on supplements? Great question. So regarding artemisinin, that's the extract from artemisia. The difference with the artemisinin, it's more powerful, but also can have a little bit more toxic effects. When you take the full herb, there's actually antioxidants in the herb that are protective against the herb itself as well, that will be protective against some of the oxidative damage. So artemisinins, very powerful, but artemisia may give you some protective effect because you're getting the full herb in there, not just the extract. Noah writes in, digesting better on your protocol, lab sent in, skin issues unaffected, great. Still some combination of tinea, ringworm, or psoriasis, 5 or 6 spots. Do I need to figure out what these are? You mean, do you need to figure out if it's tinea, ringworm, or psoriasis? Well, number one, psoriasis has an autoimmune component. So keep on doing all the stuff we're talking about on the autoimmune template and all the diet and all the inflammation reduction. That should get better over time. On the tinea or ringworm side, I would just continue to use a really good antimicrobial shampoo and just continue to treat the diet and see how much that improves. If it doesn't get better over time, then you can get it evaluated by a dermatologist and see what they think. If you need a prescription, that's fine. But so much of this may get better with just doing everything on the natural side and using some of the natural antimicrobial herbs. So give that a try first, then see how it goes. Good. And then Jeff writes in, a lot of thyroid fluttering feelings. Yeah, continue to work on the foundation, Jeff. Continue to go back to that. Charlie writes in, you should watch Joe Rogan's podcast. We sent Matthew Welker, a neuroscientist, sleep professor from University of California. Fascinating. Great. Let me know. Is there any take-home thing from that podcast you want to chat about? I'll put him on the queue. Vivek writes in, is it safe to say weight loss never happens in type 2 diabetes? I wouldn't say that. I mean, there are some people that have type 2 diabetes that aren't overweight. Most people do. The hallmark of insulin resistance is going to be some level of inability to burn fat at a lot of levels, because insulin does store fat. It does jam glucose and convert it into the cell as fat. So I think there is a hallmark there, but some people can be insulin resistant and not be super overweight. I think a lot of it has to do with how much insulin you're pumping out. Some people can pump out 20 or 30 units of insulin, which is really high, and not be insulin resistant. And some have to go higher, like some maybe more insulin resistant, meaning like 20 units of insulin knocks their blood sugar back to normal. Some people at 20 units of insulin, their blood sugar stays high. So even though they're pumping out the same amount of insulin, one person just may not, their cells may not respond the same way. So even though they're making a hyperinsulin amount there, their cells are responding to it differently. And that's, I think, the key issue. It's the fact that insulin's high, blood sugar is normal. Okay, that's good, but the insulin still is too high. You have to get that down. Insulin high and blood sugar still high. That's meaning the insulin resistance has been going on longer and it's kind of deeper into that physiological negative effect. Any ideas on what causes a constant burning tongue? Well, again, if you have thinner gut lining, just chronically inflamed gut, the tongue is kind of an extension of that digestive system. So I would look at all of the things we talk about on the digestive side. Bridget writes in, her hormones are right balance, has been burning for 8 years. It starts a week after emergency gallbladder surgery. Yeah, so you're probably, if you haven't gotten your digestion fixed, the gallbladder underlying mechanism that caused the surgery or the pain to begin with probably was not addressed. So HCl, enzymes, bile salts, and fix whatever caused that to begin with, which could be a food intolerance and or other underlying infections. Noah writes in, how is Keto FX? Anything good? Or Paleo FX? Yes, it was great. It was really good. I mean, good chats, good talks. Again, personally, I love just chatting with everyone here. It's really nice, and I can do it super fast, and we can have great combos. So I'm a big fan of my YouTube lives, but Paleo FX was great, and it was awesome to see. I saw a handful of patients there, which were great. Got a chance to talk to a lot of people. Got a chance to connect with like people like Chris Kresser and Rob Wolf, which is always good to see people like that. Mark Sisson, I don't get to see too often, so that's great. Well, actually, Charlie, I'm going out. I got grass-fed ribeyes that I'm going to be going outside on my grill here in a minute and frying them up on my grill. I got a Bluetooth thermometer that I plug in now so I can get the temperature inside to exactly a medium rare, 130 degrees Fahrenheit, where I like it. Perfect. That way my steak comes out perfect every time. So absolutely love that. So ribeyes and some green beans and a nice salad for lunch in just 5 minutes here. Charlie writes in, you mentioned before how a ketogenic diet short-term can feel great for some, but long-term they can feel worse. Can you elaborate? Some people do great on a ketogenic long-term. They feel awesome and it's great. Some do great for a while and they hit the wall. And I talked to a couple of people at Paleo FX about this, and they're like, oh, well, they're just doing the paleo diet or the keto diet wrong. I'm like, well, no. I mean, I look at people's macros. I see the fats and proteins they're eating. Some people can get a little bit messed up on keto if they do too much dairy or cheese or milk, those kind of things. Just because it's higher in fat or lower in carbs, it may have an immunogenic aspect to it. So I try to get them in the right macronutrient range. If they hit the wall, then we'll just gently nudge up the carbs primarily at nighttime. And sometimes we can see improvement from energy or mood or hair loss or just cold hands or cold feet improving. So I like to hit the wall, right? Hey, I'm feeling good. I'm feeling good. I'm feeling good. Oh, now I'm not. If that not happens, then we just gradually up our carbs 10 to 15 grams per week and see how we do. So here, Rajat writes in, total T3, 49 NG, 60 to 200 is the range. That's very low. T4 is 2, 4.5 to 12 is the range. That's really low as well. TSH is 150. 0.3 to 5.5 is the range. Yeah, you are incredibly hypothyroid, Rajat. You need to get that treated ASAP. That's like major hypothyroid, right? TSH is screaming. T4, right? Our inactive thyroid hormone's pretty low, and then our T3 is even lower. So it's like screaming, barely any volume, barely any volume. So get that looked at. All right, guys, hope that makes sense. Any other questions, any last questions, feel free and let me know. Hold on. Diana writes in, TCM says not to use many killer herbs for a long time because that will affect good flora. That is true. That's why we're only doing it for a few months. The new FM protocols recommend lots of herbs for several months. Have you seen low bacterial flora on gut test, even though you've addressed infections? Yeah, sometimes. That's why the fifth step in the 6-hour program is repopulate with probiotics. And if anyone goes to a second round of clearing herbs, we always add probiotics in with that. So yeah, we try to build the protocol in with that. Hope that helps, guys. Any questions, let me know. Sign up for the Thyroid Reset Summit, thyroidresetsummit.com. Give me a thumbs up. Give me a share. Give me a subscribe if you enjoyed this. Hope that helps a ton. Charlie, that is the one by Weber, the one by Weber grill. Take a look at it. 2 other questions. I'll rock them out fast. I take HCl, enzymes, ox bile. Any ideas why I don't produce enough stomach acid and how I can produce it? Again, yes, get the underlying issues of your gut fixed. Foods, infections, and then stress, sympathetic stress. Those are the big things that'll mess it up. And then how much safe carbs is too much? Totally dependent upon what you need. based on your metabolic type, based on how much weight you're having, based on your blood sugar. Totally individual question. Go take a look at my videos on that topic. Give me a share. Give me a thumbs up, guys. Appreciate it. You all have an awesome day. I'm going to go enjoy my grass and ribeye. Take care.